Hello, my name is Tim Breon, General Surgeon and Chief Medical Officer at Mahaska Health. I'm here to talk today about some concerns and questions you may have about the coronavirus vaccine. Some of the common questions that we'll try to answer to get to that point include the first question: what is coronavirus? What is an RNA virus, which coronavirus is? And essentially what coronavirus is that makes it unique is that it comes into the body, it injects some of its genetic material into the cells of the body, it hijacks the cells, and it puts genetic material into the DNA that starts making copies of messenger RNA, which then go out into the cell, and the cells then begin making proteins that are specific to coronavirus, and then those cells are hijacked to do the purposes of the virus and not the purposes that they're intended. And so when that genetic material gets into the cells, it just hijacks them and takes them over to use them for its own purposes. And those purposes are not always beneficial to the host, the patients that we take care of here at Mahaska Health. So understanding how coronavirus works as a vaccine to hijack the genetic material of the cell to make messenger RNA that make proteins that do specific things is really important, because that comes into play when we consider how you make a vaccine to kill that virus. So what is a vaccine? Well, a vaccine is just an injection of a component of the virus that we can put into the body. That doesn't include all the genetic material of the virus. It just contains the genetic material of one of the proteins that virus makes, so that we can develop antibodies against that protein so that we can have immunity against that virus. And so it's important to know that the vaccines don't contain the genetic material that the virus does to produce a whole host of proteins. That genetic material in the vaccine only is a small snippet of the messenger RNA, which is the template for the protein, for a protein that virus makes, that we can then replicate in our cells so that we can develop an immunity against that protein and not specifically against the entire virus. The question then becomes, how do you make a vaccine? Well, essentially, you try to find some component of the virus, some genetic material that you can then reproduce, put into a vaccine, inject it into the body, that can be incorporated into our DNA so that it can make that specific protein. And remember, the DNA is not changing or hijacking the cell. It's actually just a piece of messenger RNA that we found in that virus that we can now utilize, that will be taken up into the DNA of our cells to make only that one specific protein. It's almost like a Snapchat message. Once that messenger RNA gets into the nucleus of the cell to make that specific protein, then that is then lost. It's just like a Snapchat message. It's read and it's all gone. That messenger RNA makes that one protein. That one protein goes onto the surfaces of our cells. It doesn't hijack the cell to allow the virus to do its thing. It's simply putting that specific surface protein that the virus would make, one of the proteins, so that our own cells can have that protein. Our bodies can recognize that as something foreign, which we call an antigen, and then can develop antibodies that can kill that. And then if we get that virus, those antibodies would be available to kill the virus. How did we make it so fast? That might be a question that you might hear. I don't trust a vaccine that's made so fast. In the past, to make vaccines against viruses, it took many, many years. But remember, it took a long time to make those things because we didn't have the technical capabilities that we currently have. And so now the capabilities that we have to do things like molecular biology, to do gene sequencing, to identify specific genes within a virus, we can do those things so much more readily now. They can be tested along the way and be safer earlier than any time in the past when we've been trying to make vaccines. So these vaccines have been tested more than any other vaccine, and they've been tested in a way that it could be done so much quicker, so that this vaccine would be available in a much shorter time frame. And I know that concerns a lot of people, but I think it's just credit to the scientific community of how the abilities that we've been given as scientists and as physicians to be able to do the kinds of things that we can do now. It's just a blessing and not something to be feared. Another question is, what's in this vaccine? Well, the vaccine essentially contains 4 components. It contains the sequence for the messenger RNA that's needed so that the body can use that as a template one time to make that protein, which becomes a surface antigen that the body can build antibodies to. That's the main component, but there are other things in that vaccine which are safe, which are just put in the vaccine so that the messenger RNA sequence can be used by our body to make an antigen so that antibodies can be produced. So there are also salts that help balance the pH of the vaccine. There are also lipids or fats that are 4 big molecules that have big long names that are put around this messenger RNA to protect it so that it can be injected into our body and survive long enough to do the job that it has to do. There are also sugars in that vaccine which are there to help supply the additional nutrients and necessary ingredients that can keep that messenger RNA happy until it does its job. So really 4 components: the messenger RNA, small snippet of genetic information that's involved in this virus that we can use to make a protein. It's a ingenious technique to make a vaccine. Also the salts, the fats, and the sugars, and that's essentially the 4 components of a vaccine. Lastly, who should get a vaccine of this type? If we had enough vaccine, it would be wonderful if everybody could get it at the same time. If it's as effective as possible, it's the best way that we have to slow down and stop the spread of the coronavirus pandemic. It needs to be administered first to those people that are working with patients that have coronavirus, such as long-term care facilities where the outbreaks in Iowa have been significant. Also healthcare workers that are dealing with coronavirus patients on a daily basis. And so that's the first group of people that should get, because we believe that as the vaccine becomes more readily available, its efficacy is better understood, and people understand that it's a safe vaccine to get, then more people are going to want to get it. And so I hope that answers some of the questions about the coronavirus vaccine that people are talking about. We're eager to get our hands on some of the vaccine here in Mahaska Health and in Mahaska County. We have a great team of public health personnel that are working daily to facilitate this. We have a great team of providers that are keeping up to date on the vaccine and are going to be ready and willing to answer your questions that you may have regarding the vaccine. And we also have just a great team of providers, staff, personnel here at Mahaska Health that are continuing to provide care for coronavirus patients, and also all patients at this time, still a very challenging time. So we want to thank you for your patience, thank you for your understanding, thank you for keeping an open mind and understanding that we're going to make it through this. And at the same time, we'd also like to wish you the best during this holiday season. Thank you.
Hi, I'm Denyse Gipple, Population Health and Quality Director at Mahaska Health. We've been planning for quite some time to be able to receive vaccines for COVID-19. Probably heard on the news there's a couple different vaccines that have been approved through the emergency use authorization. The first was the Pfizer product. That was shipped mainly to bigger hospitals because it needed to be kept at the ultra cold temperatures, and it was shipped in lots of 1,000. So that was targeted for those larger areas. So the Moderna vaccine is the one that will be shipping out now that has just been approved. It does not have those requirements for ultra cold storage. It can be kept in a normal freezer, and it's shipped in smaller lots, so it's better for rural hospitals and areas like Mahaska County. There is no significant difference between the vaccines, so they're both mRNA vaccines, and they both have very similar efficacy rates in protecting against coronavirus. Anyone that chooses to be vaccinated is going to be provided with all that information from the emergency use authorization fact sheet, and we'll post those just as soon as we have those available to share. We don't see the potential for a large number of severe side effects with this vaccine, and most side effects are a sign that the vaccine is working. So we do want people to report those so we can keep track of them. Cost is not going to be an obstacle for anyone to be vaccinated, as these vaccines were developed using taxpayer dollars. So we still need to be vigilant in wearing masks, practicing social distancing, and daily assessment of our symptoms of COVID-19. So that's what's really important. As we work cases of COVID-19, we see people who went and had an assessment done right away, and we're really thankful when that happens because we know they're doing everything they can to prevent the spread of disease. So really pay attention to your symptoms. If they're out of the ordinary, if they last longer than something you feel is typical for you, and make sure you're getting assessed when you need that. So just some myths about the vaccine. The COVID-19 vaccine cannot actually give you COVID. It is just a piece of the mRNA that shows your body how to fight the disease. So there's nothing live in the vaccine, and it's not going to cause you to test positive on a viral test. So if you receive the vaccine and later you have symptoms, you can still be tested. You would test positive if you actually have disease, and you would test negative if you don't. So the vaccine doesn't get in the way of that. And we are also looking to people who've had COVID-19 to receive the vaccine. So since we don't know how long the immunity lasts for someone who's had the disease, we are still encouraging those folks to get vaccinated to provide longer lasting protection. And the biggest thing is just knowing that vaccination can prevent severe illness. That's one thing we talk about with every vaccine. So even the flu vaccine each year, we talk about how it prevents severe illness. And the hope is even if you do get the flu, it's not as serious for you. So that's what our thoughts are with the COVID vaccine as well. We want you to get vaccinated to prevent those really serious cases and prevent you from passing along to others as well. So thanks for all you're doing in the community every day to prevent the spread of COVID-19.
Hi, I'm Patty Malloy, registered nurse and Mahaska County Public Health Coordinator. Public Health and Mahaska County are excited about the vaccine that we've received notice will be here sometime today, Tuesday, December 22nd. Because of the limited amount of vaccine each state is receiving, the Iowa Infectious Disease Advisory Council has created a multiple-tiered approach on how vaccine will best impact everyone during this pandemic. The first tier is called 1A, and it's been identified to help alleviate some staffing issues faced during the pandemic on those that come to work each day knowingly caring for those who are ill with COVID or caring for those at high risk of getting COVID. Public health and facilities that receive the vaccine are distributing it on a statewide standing order issued by the Iowa Department of Public Health Medical Director and State Epidemiologist Dr. Caitlin Pedotti. These guidelines are specific. Currently, we will be working with Tier 1A. After that tier has been completed and we receive more vaccine, we will move on to Tier 1B. As more vaccine becomes available, the groups and tiers will be explained, and local public health will share this information as soon as it becomes available to us. One of the questions we're hearing a lot about is where will vaccine be available? We will also share this information. Right now we're planning to do this on campus, but we will be looking at other options if needed. What to do until the vaccine is available for you and you've completed your series of 2 shots. Mask, social distance, wash your hands, and limit those in your circle of contacts. And you can also get a flu shot. This would be helpful with the healthcare system not being surged. Public Health has been planning for vaccines throughout the pandemic when they become available, so we will give them as soon as they become available to us. Just want to thank everybody for doing everything to prevent the spread of this virus.